Has anyone recovered from Lyme disease? The short answer is yes. This is a Common Sense Lyme series where I discuss cases and questions that come up in my practice. I'm Dr. Cameron, so let's begin. Now, recovery is possible, especially with early diagnosis, so I stress even if you're not completely sure that rash is 2 inches or greater, it's not completely a bullseye, be aware. In fact, most Lyme rashes are more flat red rashes. Also, if there's a broad range of issues without a tick, without a rash, I always encourage at least considering Lyme disease, even if the test doesn't show it. Now, some people take longer for recovery, some take more complicated treatment, but yes, recovery is possible even in people who have chronic issues. Now, early diagnosis leads to early treatment, better outcomes, less suffering. Some of the common drugs I might use is doxycycline or their related drugs like tetracycline, minocycline, amoxicillin, cefuroxime, which is marketed under Ceftin, Zithromax, and Bioxin. These are the drugs I use the most often. But because Babesia is a parasite in a tick, sometimes I have to add treatment with atovaquone, which is marketed as Malarone or Mepron. When it's caught late, there's different words for it: late Lyme disease, late stage Lyme, chronic neurologic Lyme, chronic Lyme, encephalopathy. Different names. In some ways, it depends on who's discussing the case. Sometimes it depends on what the clinical presentation is. But certainly it can take a longer time to recovery, and there's more symptoms. More support's needed in someone who's been chronically sick. Now, some doctors are using the word post-treatment Lyme disease syndrome. They've had at least a month of therapy, so they call it post-treatment, and it's a syndrome. Now, I don't like to use that term because even though it describes patients with fatigue, brain fog, joint pain, etc., is that some of my colleagues focus on the immune dysfunction. They don't discuss that it's a possibility of Lyme or a co-infection that persists, that hasn't been resolved with treatment. So I'm reluctant to use that term. I use more chronic Lyme disease, late Lyme, neurologic Lyme, or just that they're sick with Lyme complications. Now, when you treat complicated cases, I find that I have to take on not only the infection, but I also have to take on some of the symptoms and do what I can. So I'll often involve an orthopedist or physical therapy if I'm having joint pains and joint complications. Sometimes I just individualize a approach. So I might have them get from the bed to the couch, move around the house, get some movement going, try to get them so they can start walking again. Sometimes just daily living of just being in the house or going to work all helps with the inflammation and helps with the Lyme arthritis. But neurologic Lyme often involves, in my case, counseling, discussions of what's happened. Patients have had so many complications. They've been to psychiatrists, psychologists often, and they've been sick, but they don't know how to resolve this complicated neuropsych issues, or they have been to a neurologist and haven't figured out how to take care of their encephalopathy. So I find that discussions, goal setting helps. I send to specialists if I need to. And with Lyme, it can be complicated with heart block and heart failure with some patients, but that's usually easily treated. We try to prevent needing a pacemaker. Now, what helps most in my practice is early aggressive treatment. I don't like to wait around for weeks, months, and for every other specialist to see them before they look at Lyme a second time. I often involve treating for co-infections like Babesia. Some cases they appear to have Babesia right from day one. So if they have sweats, air hunger, plenty of autonomic issues, I might institute treatment for Babesia rather earlier at the beginning. I don't find the test as reliable as I would like, so I'm constantly having to use clinical judgment. Now, if I use clinical judgment, I have to also be on the lookout for make sure that there's not another illness out there causing the same problem. Some people have two illnesses. They have two conditions, and they both need to be managed. I also have to deal with lifestyle issues. I have patients who don't eat very well, or they still drink alcohol. They're not very active, and so I do what I can to support them. Some of them go to alternative medicines if they're, but I do quite well with just the classic diet, with staying away from alcohol and spending my time on counseling, goal setting, and understanding their disease. So my approach is still individualized care rather than a one size fits all. I try to take care of the physical side if they need to, or the cognitive and neuropsych issues if I need to. And if a team is helpful, I'll have other doctors involved in treating them at the same time. The bottom line is recovery happens. I have patients who fail treatment, but often I have patients who thought they were going to fail treatment. They've been sick for months to years. They didn't think they were going to get anywhere. And when they get retreated or treatment for a co-infection, they do well. And I think that if you are patient, you'd be surprised how many people they find they heal over time, even though they thought they weren't going to get better. But you're not alone. Thank you for joining me for this Common Sense Lyme series. Have a good day.